for more services for the Bronx overall, but particularly when it comes to the fact that the Bronx is has one of the highest rates of infant and maternal mortality rates in the state. And that is something she has worked hard to eradicate, and we've been partnering on a lot of initiatives. I want to thank her for what she has done. You're also going to hear from Bruce McIntyre from Save a Rose Foundation, who I said, personal stories can often lead to change in policies, and it's his profound story that he'll share with you that has touched the hearts of many of us and has fostered a different environment, a different attitude about the challenges that moms are facing when they go in for delivery. And also Marlene Rivera, who's a mom and an advocate, is going to talk to us. Also, I'm delighted to have our elected officials who've joined us here today. We have State Senator Gustavo Rivera is here. Thank you, Senator Rivera. Assembly Member Jeffrey Dinowitz, thank you. Assembly Member Udelka Tapia, thank you very much. And Councilmember Eric Dinowitz as well. So we just finished up a conversation in this very room. We sat with a number of moms and advocates and people telling their stories. And talk about the challenges of pregnancy, the challenges of raising kids, which I know are very severe sometimes. But, it reminded me that parenting is one of the most greatest gifts we've ever been offered in life. It's something, despite the trials and tribulations. Let's keep the light on the subject. It's a profound experience, but let's admit it, it's stressful, right? I mean, all the stresses of providing for the child, and if someone is struggling or perhaps a single parent, it's compounded. And so we have worked hard as a state to find ways to just help parents. I've said all along, your family is my fight, and I'm committed to that in various different ways. And one of them is making sure that the experience of childbirth is positive for you. That's why we want to make sure that you have the opportunity to leave your job and still get compensated for those prenatal visits. We are the first state in the nation that prioritizes the health of moms and babies before birth by saying you can have 20 hours of paid leave in this state, even if you would have ordinarily lost your income. If it's a minimum wage worker, if you don't show up, you're not paid. We've ended that here in the state of New York, and that's something I'm really proud of. And I think we're going to see much more positive outcomes because of that. We've also said, we understand the cost. The cost of parenting is off the charts, but in those very first months, the formula, if they're having formula, what you need to be a nursing mom or to buy the diapers. I mean, I had found out this weekend that the Pampers size 1 didn't work anymore. We had to go out and get Pampers size 2. So I have a fresh pack of Pampers size 1 if anybody wants them. up at the governor's residence. But that's what I'm talking about. I mean, the changes that, they change so quickly. And, the clothing, I went out and bought a couple of outfits. We're no longer 3 to 6 anymore. We're into starting the 6 to 9. And so, but these all add up. These all add up for families. And so we recognize that, as well as working with the legislature on putting more money back in people's pockets. And let's start with the fact that when I first became governor, parents with children under the age of 4 received zero. They got nothing. It had to be a 4-year-old and up in order to get $300 a year as a child tax credit. I said, no, that's just absolutely should be turned upside down. Parents with children under the age of 4 will get $1,000 starting this year, starting in January. They can start applying for that tax credit. So let's get the word out about that. We also launched November 1st this year, the first time ever, an $1,800 baby benefit for qualifying families with a newborn. If you're getting public assistance, you'll automatically get a check for $1,800 to cover that cost of the stroller and the car seat and all the other things that are so expensive. So that's more money back for parents, of course, as well. So also some of the families, I'm sure, received their inflation rebate. Just came out in the mail. A lot of people getting that, and I'm hearing a lot on that as we walk the streets. But I want to make sure that you know that that's money in your pockets, but let's zero in on maternal care and infant care when they're born. We know the statistics are staggering, that black women are 3 to 4 times more likely to die, and black babies are 2.5 times more likely to die in childbirth. It is, those numbers are staggering, and they feel so unnecessary, and you have to ask, what's at the heart of all this? And we've done a lot on this. We've issued policies to minimize unnecessary C-sections, for example, and we've promoted doulas, and I mentioned the doula directory and getting birthing centers and different places we can help so we can avoid unnecessary C-sections. And we have time off for pumping moms. We have mental health services for moms. I mean, let's be honest, folks. It's a rare mom who doesn't need some extra help when the baby comes just because your hormones are out of whack. And especially if you have other crying children. I had a couple close in age, so I don't want to go back there. Okay, I'm over now. The kids are having their own babies. I'm watching them go through it. So you know what I'm talking about, right? You know what I'm talking about. So my job is to find programs that lift up families. I mean, life is hard enough, and you have a governor and a state that understands what you're going through. We need to be your allies. We need to be your partners. And we want to continue making sure we keep those investments. And so we talked about something about a year and a half ago. Vanessa Gibson hosted a roundtable for us in her office, and a lot of expected parents and advocates and members of the doula community and others who came and told their stories. And at the time, we invested $8 million to support the doulas here, but also to expand a maternal center for excellence here in the Bronx to help out families that are in need. But also, she kept saying this to me. She says, we used to have a birthing center. We are the first community to have a birthing center in New York, and then it closed. And her passion and her mission has been to have that restored. I am here to make that happen today. I am announcing today $5 million of state dollars to go toward helping this dream come true right here in the Bronx, to provide an alternative and support system for expectant moms and to make sure they are healthy and their babies are healthy. And we're going to get that done. So congratulations. We'll be making sure that we have a place where you'll hear Amber's story from Bruce, but a place where those stories are in the past. They don't happen anymore. Every mom who walks in to deliver a baby walks out. Being an expectant mom should not be a death sentence for women of color. And for far too long, that has been the case. And so we're going to keep these investments. This center will be serving at least 300 people the first year is the expectation. And so we're going to continue to expand from there. And so I want to make that happen, make sure that you know that New York State is the best place to raise a family. And we're going to continue being your partners and not your doula per se, but in one sense, your doula to help you get through it. So thank you, everyone. And again, I appreciate from the bottom of my heart the moms and the advocates who could be very focused on themselves and their own families and their children, and yet they take their stories and their advocacy all the way to the halls of Albany and here in the city of New York. And I'm so grateful that they lend themselves to that journey, which is so critically important. So with that, let me turn it over to our Bronx Borough President, a tremendous champion for families here and across the state, Vanessa Gibson.
Thank you. Thank you, Madam Governor. I am so grateful to be here. Happy Monday, ladies and gentlemen, and thank you so much for being here at the Miriam Clinic right here in the beautiful Norwood community. This is a beautiful space. It is a reproductive health and wellness clinic and hub for so many of our mothers here in the Bronx, our expecting mothers, and many of our birthing individuals. Today, we take a giant step forward in our collective work to address maternal mortality and morbidity, to stand up for so many of our mothers here in the borough. Knowing the statistics, knowing the data, knowing that the disproportionate impact of Black and Latina women that are facing pregnancy-related complications due to insufficient health care. We believe in birthing centers, we believe in healing spaces, and we believe in spaces that are culturally relevant and significant with language diversity and real access. That is what today means for so many reasons. As the Bronx Borough President, creating a birthing center has been a strong part of our agenda and our blueprint as Borough President. We released a birthing report called Bronx Mothers Matter, because all of our women and birthing individuals matter when it comes to health equity and health justice. And today's announcement by Governor Kathy Hochul, the first mom governor, the first abuelita governor, first grandma, she has taken maternal mortality and morbidity as a major pillar of her agenda across the state of New York. This affordability announcement recognizes the important work that is happening right here at Miriam Clinic. All of our birth workers, doulas, and midwives that do this work every single day. We lift all of them out. We lift up their voices because their voices are powerful in this space. The stories that we have heard from so many mothers and women that have not felt that they have had a level playing field when they go to their doctors, we are the answer, and this is the answer. A $5 million commitment solidifies the impact of this work. The new baby benefit, that's important for so many of our working class families right here in the Bronx. Expanding our child tax credit. It matters when we show up for New Yorkers and for our families. And that is what Governor Kathy Hochul is doing every single day. And I'm so grateful that she is a friend to the Bronx. We have had roundtables with all of our birth workers, doulas, and midwives. We've talked about challenges in the industry, so many stories that we've heard from clients, but also solutions-based, community-driven solutions based on the experiences that we've heard and learned about. So today matters for so many reasons, and I'm so grateful to our partners in the State Senator Gustavo Rivera, Assemblywoman Yudelka Tapia, Assemblyman Jeffrey Dinowitz, and Councilmember Eric Dinowitz, who not only represent this community, but are leaders as well and are lending their voices to this movement. So far, the state of New York has enacted incredible legislation, and I want to recognize the increase in the Medicaid reimbursement rates for doulas because it recognizes cost of living and the cost of doing business. I also want to recognize the legislation that Governor Hochul codified in law, where we're now creating a doula directory across the state of New York, from Brooklyn to the Bronx to Buffalo. That is what is happening here. And so today matters so much, and I am just so grateful that Governor Hochul believes in the Bronx, believes in Bronx mothers, right? And that is why we're here at the Miriam Clinic. And so I just want to express my appreciation and my gratitude to our governor and her team for believing in the work that we're doing. This is a dream come true. $5 million is a lot of money, and that is going to create our birthing center, because we were the first in the entire city to open a birthing center back in 1988, and it lasted for 20 plus years, and now it's been closed. We've not had that birthing center experience. Because of today's announcement, because of this consortium and this collective, we are going to get a birthing center back in the Bronx. I am excited about that. And so I just wanted to say again to our governor for this affordability announcement, the tax credits, the baby benefit, it matters when you are putting money back into our families' pockets. They can use that for other items to make sure that they're taking care of themselves and their families. So again, thank you so much, Madam Governor, for being here, for being a friend, for standing up, and for delivering for the people of the Bronx. Bronx mothers matter, ladies and gentlemen. And now it is my honor to recognize our co-founder of this Miriam Clinic right here. This is a beautiful space, and I want to acknowledge all of the patients that have been in and out of these doors. This is a space that was a dream of two co-founders that came together, women of color, and said, we need a reproductive health and wellness clinic. We need a hub. We need a beacon. We need a circle space. And that is what we have here. So it is my honor to recognize the co-founder here at Miriam Clinic, as well as the womb bus, the mobile unit that was rolled out. Ladies and gentlemen, please help me welcome Myla Flores.
Thank you. Thank you so much. I am incredibly grateful to Governor Kathy Hochul for this gift, this investment to the birthing place and our initiative to build a birth center right here in the Bronx. We know the care for maternal health needs to continue, and we seek to do that with our very center right here in the Bronx. As a birth worker and advocate, I've seen firsthand the impact of our support to families, and the Womb Bus has been able to bring resources to so many families throughout the Bronx as our first phase of development. And now having this clinic that you all are in, thank you so much for being here. This is our opportunity to bring Mariam Reproductive Health and Wellness Services and the collaborative care that our practitioners provide right here. And so now we are making a difference through that initiative and working to open this birth center, which is so exciting. Thank you so much. Yes, and so the state's generous funding is going to help us prioritize community-centered care and empower families to make informed decisions, have more autonomous experiences, have respect and dignity in their healthcare journey. We're committed to expanding access to midwifery additionally statewide and access to birth centers statewide as the Birthing Place Foundation seeks to serve that this center will be a model of integrating birth center care into our state. And we thank you, the community, the partners, everyone who's been here supporting and fighting for the opportunity to make this a reality. Today is possible through the resources, not just the financial resources, but the energetic resources of our community. And I look forward to this continued partnership here in New York. We are excited to be able to create more safe and healthy health care, and that every birth be a celebration of life and love and empowerment for the families and the communities here in the Bronx and beyond. Thank you. And I will hand it over to, let's see. Okay, there it goes. Bruce McIntyre from Save a Rose. Bruce, my dear, has been a wonderful advocate along the way, and I'm so grateful. We're also grateful to have his advocacy in this fight that we are committed to continue forward.
Thank you so much. Hello, everyone. My name is Bruce McIntyre III. I am the founder of the Save a Rose Foundation. I'm an advocate. And this past year, I was the only sitting male on the New York City Council's Maternal Health Steering Committee. And I just want to thank you, Governor Hochul and Bronx Borough President, for your tireless commitment in bringing us here together today. We're here to talk about affordability and maternal health care, two issues that shape the lives of families here in the Bronx and across New York. As a single father, I know how tough it can be to raise a child and juggling the raising cost of living. These challenges are very real for families everywhere. And as many of you know, the maternal health is deeply personal to me. I lost my partner, Amber Rose Isaac, due to medical negligence that was 100% preventable. And I've dedicated my life these past 5 years to make a difference. To make a difference and make a change that families deserve. While we've made meaningful progress, there is still much work ahead to ensure every Black and brown woman receives the safe, respectful, high quality of care they need. I appreciate Governor Hochul and Bronx Borough President's tireless commitment to this issue. I was with you in the Bronx last year when we stepped in to invest in maternal health care facilities and increase to doula services. And now I'm proud to stand with you again here today to announce our new support for the Birthing Center and expand the resources women need in healthy pregnancies and creating safe birthing outcomes. I especially want to recognize Myla Flores and Dr. Carla, for whose dedication has always transformed the lives of so many women and families. I know the impact will only grow with the expansion of the center made possible by this investment. And I want to thank you for all you do. I trust you with my lives, and I trust you with the lives of the community. And I have full faith that everyone that you're going to encounter is going to feel the same way.
Beautiful.
Thank you again, Governor Hochul and Bronx Borough President, for your leadership on affordability and maternal health care and putting families first.
Oh, that's nice.
And now I will turn it over to another member of the community, Marlene Rivera.
Hello. Thank
I'm so excited to be here. My name is Marlene Rivera. I'm currently pregnant with my second child. My first birth was at a hospital, and I experienced firsthand the discrimination, the lack of options, the lack of consent. This pregnancy has truly changed my life, and this space is a big reason why. I sought out different care, more options, more resources, and I was able to walk into one space and be offered everything I was asking for. So going forward, this support from the state, this monetary contribution is probably going to change the lives of so many women like me who maybe faced something completely terrifying the first time. And there's so much power in choice, just having the option. Had I had the option of having a birth center in the Bronx where I live, I would have went that route the first time. This time, midwifery care has changed everything about my pregnancy. I'm so much more comfortable. I'm heard. I'm confident that if an intervention is necessary, it will be because I've been spoken to about it and not just pushed aside. I also wanted to thank the governor for the tax credit and the baby bonus, because my first time around, my son was allergic to everything. His formula was $45 a tiny can. It was so expensive, and I couldn't produce enough to feed him myself. So having to confront financial burden with the emotional struggle, and I thank you very much for every mother that's going to receive this. Yeah, that's it. I just wanted to say, I want to make sure we know I'm very grateful for all of us moms, even Courtney. Thank you.
Wishing you a beautiful life.
Thank you.
Beautiful. Beautiful. Amazing.
All right, now we have time for a couple on-topic questions from members of the press. Any on-topics?
Okay.
Hi, Governor. Maya Copper from Politico. My understanding is that one of the obstacles to opening birthing centers like this is regulatory hurdles, along with the startup costs to surmount that. What are your plans to address that and make it easier for facilities like this to open in the future, not just this one?
Let me give you a broad answer first. I am sick and tired of regulatory burdens that stop what otherwise are good policies from becoming realized. I'm talking about housing, for example, why we don't have more housing built in the city of New York. A lot of it is regulatory burden or others who put up obstacles to try and stop things from happening. And in this same category. So I am committed to, once we say we want to do it, the borough president wants us to do it, the community wants us to do it, we'll find the path forward. We'll absolutely find the path forward. I think a building's been identified for this, yes?
Yes.
Yes, a building's been identified for this, and whatever assistance they need from the state of New York to get it done as soon as possible. That was my first question. When will this be open?
2027.
Okay, 2027. We're committed to 2027, so I agree with you that there are burdens and hurdles, and they have to disappear. No more.
Any other on-topic questions? All right, thanks, guys. We'll excuse our speakers back here, and we'll have time for just a couple off-topics.
All right. Thank you, everybody.
Thank you.
We'll see you out back. Right, thank you. Thank you.
Yes, thanks, Courtney. Good luck with the new baby. Thank you.
Good luck.
Thank you. Oh, my gosh. You're here?
I'm here.